I'm Dr. Parasuram Gopinath, based out of a center in Kerala called as CIMAR, and I'm basically an IVF specialist. So if you think of 10 women you know, your mother, your sister, so your daughter, your aunt, at least one of them will have this disease. They say that it is as common as diabetes or asthma, but still you really don't know what this disease is about. They say you take up to 8 years or up to seeing up to 10 doctors to diagnose this disease. This is nothing but endometriosis. It is nothing but the presence of the inner layer of the uterus, that is the endometrium, that is getting implanted to the outer part of the uterus. You can actually see in this particular image here, you can actually see this is the uterus, the tubes, and what is there in the inner layer of the endometrium gets implanted in the outside of the uterus. So every time the patient bleeds, or these are implants of the inner tissue to the outside. So every time the patient bleeds, you actually have end up having some kind of a bleeding outside, which can end up causing adhesions or some kind of sticking. If it is in the ovary, can create ovarian cyst. A lot of people are suffering to the large extent that their daily routines are affected, especially when the time of their periods, when they're having severe pain. There are people who are not able to go to work, they're not able to go to school, they're not able to even stand up straight. Unfortunately, there are still a lot of things that we do not know about the disease. A lot of times we realize that yes, we know that this has got some kind of an endocrine and immune related disease that this is. We know that it's seen more in families. What is important that you realize is that if you have the disease, your daughter is having a 7 times higher chance of having an endometriosis. We know that it is primarily seen in a particular, more common in a particular geographical area. Some kind of external toxins does definitely is a reason why endometriosis is seen in this group of patients. Unfortunately, this disease is so variable, it is so individualized that you cannot really diagnose it in the initial phases. What happens is, there will be people with very small disease or early stage of disease having severe symptoms. At the same time, you actually have patients with very advanced disease but having very little symptoms. The symptoms can also be variable. They can have pain, abdominal pain during menses, they can have bloating, they can have vomiting, they can have GI symptoms, they can have urinary symptoms. So what ends up happening is you end up getting shifted or shuttled from one consultant to another specialist, saying that okay, we are not able to find out the reason. Okay, why don't you go and meet a gastroenterologist, or why don't you go and meet a urologist to find out about the disease? So the biggest issue is that majority of the investigations initially also will not show you what disease it is or when it is started. Unfortunately, a lot of times when you're investigated, any kind of blood test that has been done or any kind of ultrasound, unless you end up having cyst or severe adhesions that everything is stuck to each other. Otherwise, if you don't have any of those findings, then it is very difficult to understand whether it is there or not on an ultrasound or any imaging modality. So that is one of the biggest challenges as far as endometriosis is concerned. So because of that, you end up diagnosing it much later and you end up treating it much later. See, you see today that around 20 to 40% of our infertility patients have some form of endometriosis. See, because of all these bleeding and things outside the uterus, the tubes, ovaries, everything are stuck to each other. So the actual normal anatomy is distorted. Because the normal anatomy is distorted, the egg and the ovum are not able to meet each other inside the tubes. So that is one of the major reasons for infertility in these group of patients. One more thing I like to point out here is that a lot of times earlier we used to always talk about diagnosing it only with the help of a laparoscopy. Laparoscopy is a keyhole surgery. Still, it's considered as a gold standard for diagnosis of endometriosis, but you are able to diagnose these early cases of endometriosis where you only have small patches in and around. Those things can only be diagnosed with a laparoscopy. Whereas in patients with severe endometriosis or patients with endometrial cyst, severe adhesions where things are all stuck together, these cases can be diagnosed much earlier or with other imaging modalities like as ultrasound or CT or MRI. Now I think how to treat or what to treat. First of all, you should understand one issue about endometriosis is that it is something that cannot be completely treated. It can only be suppressed to a certain extent, because our treatment primarily should be focused on what is your problem, and depending on the problem you need to be treated. For example, if pain is your major concern, then you need to address the pain first. If you need to take medications as far as pain is concerned. If infertility or not having a child is your problem, then you need to focus and do treatment to reduce the or increase the chances of getting pregnancy is concerned. And you should understand all these treatment entities are primarily only temporary, that you're actually doing it only as a temporary. You're just covering up the symptoms. Or even if you're doing a surgery, one thing that you should always be understood is that you're currently only removing that tissue at that point of time. There's a very high possibility that the disease can come back at a later stage, even in a more severe pattern. So, like I said, the patient needs to be treated depending on what her symptom is or what is her symptom. Then you treat the patient accordingly. Now, if you look at the different kinds of treatment options that are available, yes, when you're talking about a long-term treatment where there is a younger group of younger girls who are having severe menstrual cycle, you have a lot of these young people who are actually having issues will not understand how to go about this treatment, how should we try it. At that point of time, unfortunately, majority of the treatment is focused on long-term treatment in the form of diet, exercise, yoga, medication, and painkillers to a large extent. Because there are limitations, or there are initial limitations as to how much or how aggressive you can be treating these group of patients is. If you look at the medical treatment that is available, we currently have oral contraceptive pills, which is one of the most commonest treatment possibilities, and I would also still recommend that for majority of the people to start using oral contraceptive pills so that you can actually reduce the symptoms or at least prevent the progression of the disease. Because if you do not treat them, the disease keeps on progressing over the years. What was only very mild one will keep on increasing, and unless we at least stop the procedure with some kind of a pill or something like that, the disease will keep on getting extended. Now, the last option or the final option of treating this disease is by doing a surgery. Again, like I said, I would like to emphasize again and again, surgery is not something that you can completely remove the tissue. There are certain situations that people become so much better after the surgery, but you should always understand that these disease will again come back at a later phase. So it is very important when to time the disease. Time surgery is a very important aspect. But one thing when we talk about surgery is something that you should always emphasize, that the first surgery is the most important surgery. So it has to be done timed at the right time. For example, immediately after surgery is the best time for people to get pregnant. So when in a young girls who are not plan to get married or not getting plan to get pregnant after they get married immediately, we do not recommend them to go for a surgery, but to go on some kind of a pills or some kind of estrogen contraceptive pills, so that this disease can be suppressed till a time when they are ready for their marriage. And time the surgery in such a way that once a marriage they try for 6 months. A severe disease does not mean that you do not get pregnant. It just only means that your chances of getting pregnancy will reduce. So once you focus your treatment accordingly, do the surgery at the right time, and then only, because the people who get endometriosis much earlier are having a more aggressive form of endometriosis. So they end up having if you look at, they end up having very severe form of disease. So when you actually correct the disease when they're much younger, when they come back later with much more severe disease or much more severe bigger cyst, severe adhesions, so that and the more the number of surgeries that we do on an endometriosis, you're actually going to operate on the ovary of the female. The ovary of the female contains eggs, which is very important for the reproduction. That is, the eggs from these ovaries are the one that is contributing to for them to bear a child. So the more the number of surgeries that is happening on an ovary will reduce the reserve or the overall quantity of the number of eggs that is there in this group of patients, and can cause issues as far as them getting pregnancy is concerned. Because what you say is that this adhesiolysis, or the amount of that adhesions that are removed immediately after surgery, the best chance for her to get pregnant is within the first 6 months to 1 year. If they do not get pregnant within the first 6 months to 1 year, the possibility of them to actually go for a higher treatment such as IVF and all is much higher. So in this scenario, it is very important, like I said, to understand and to understand when the patient needs to be treated. So this is just a basic idea of how we start about understanding what this particular disease is, how do we diagnose this disease, or how do we go about treating this disease. So these are the few, at least the important points that I would like to bring about, so that people are aware about this disease much more.